the other things we need to be aware of, there's a lot of research in the last 10 to 15 years on genetics, epigenetics, a lot of diseases, growth problems we have more information and knowledge on. And for many conditions, nutrition has an important role in the prevention and management. So I think when I was a student, I don't know if I went to lectures or even, I don't think we had any equine nutrition lectures, but it actually is quite an interesting area and takes into account a lot of other parts of veterinary medicine. So horses that can benefit, certainly pregnant mares, you're probably aware they are at risk of insulin resistance at about 26, 27 weeks. Growing horses, obviously, with the developmental orthopedic diseases, and many veterinary clinical conditions such as arthritis, behavioural problems, body composition. There's a lot more information now available on the role of nutrition in colic, certainly not just the diagnosis, but the feeding management is really important, including Cushing's, dental conditions, diarrhea, endocrine, EPSM, hoof problems, even injuries. We can do a lot to help in healing of those. And for performance horses, the body composition in terms of the power to weight ratio is really important. So we see anything that doesn't have proper muscling or top line, you'd be surprised at what you can find with the diet analysis. And there's some very common findings. Obviously, muscle conditions, post-surgery, stomach ulcers, and skin conditions. Nutrition can have benefit or a role in most of those conditions. So the areas in which our nutrition knowledge has expanded are fibre type. So this is really important for movements of fluid in the large intestine, and earlier cut hay has high water holding capacity. So there's heaps of information on those. Sources of energy and how they affect performance and muscle function, and the feeding management is really critical. This is just a quick look at what mineral interactions, what minerals interact with each other, which is basically a lot. And the importance of that really is when there's a huge excess of one that can interfere with another. So common problems with diet analysis. So most diet problems, as you'll be aware, don't cause acute or overt clinical disease, but they can cause a range of symptoms. Often the clinical signs of a nutrient imbalance are vague, difficult to diagnose, and not top of the differential diagnosis list. One of the most common ones are lysine and essential amino acid deficiencies, and that's primarily because the most important nutrient, most expensive nutrients for manufacturers to include are lysine, essential amino acids, biotin, and vitamin E. So they're quite commonly deficient in most diets. So if we look at how do excesses occur, and these two are examples of horses that had excess selenium. The first one, the selenium was over 1,000% of recommended, and the second one pretty much the same. And it's not any particular company proprietary feed, it's the combination, because a lot of these things contain the same minerals. Now we're going to just have a look at some case studies. Now this is an interesting one. This is a horse that has anhydrosis. It's an older horse.